We're connecting with doctors. We're connecting with community experts. We're connecting with you. This is Connect by 3 News.
And hello again, and thanks so much for joining us on 3 News Connect with Monica Robbins. I'm Jay Crawford. We are still, of course, broadcasting from our home studios, but still connecting with you in an effort to answer all of your latest questions, as well as get you all of the latest headline information concerning the coronavirus. Hello, Monica.
Hi, Jay. Yeah, it is so important to remain physically distant from each other, but we're certainly not socially distant from each other. Yes, we are still coming to you from our homes in an effort to follow those guidelines that are still in place and that are still working. But the information about COVID-19 is constantly changing. So let me give you the latest headlines and developments. There are new numbers that show there are now 189,753 confirmed cases of COVID-19 in the U.S. The good news, those numbers show most of those patients do recover. There is an optimistic sign coming from Italy. The infection rate appears to be leveling off, and new cases could start declining. And it was just announced that Wimbledon has been canceled due to the pandemic. This is the first time the event has been canceled since World War II.
Wow, Monica,
Jay?
in Berea, 6 firefighters and paramedics are now in quarantine after testing positive for COVID-19. All of them are said to be resting comfortably and recovering at home. The station now undergoes more frequent cleaning and disinfecting, which of course is a good thing. The city of Berea says neighboring cities are ready to help by offering their support if staffing does become an issue. And this is concerning as well. The Cuyahoga County Board of Health says it is now investigating a cluster of COVID-19 cases at the Manor Care Health Services in Parma. Both patients and staff members at the nursing home are being tested and screened for the virus. Right now, no numbers were given on how many people we're talking about here or the conditions of the patients. We'll certainly keep you updated as we get more information. Monica?
Well, Jay, today marks the start of a new month, which also means your bills are due, but paying them may be quite difficult for several people. Millions of Americans, of course, now out of work, and the pandemic is hitting companies both big and small, as more than 160 million Americans are waiting for those relief checks from that $2 trillion rescue package.
It's really scary because my rent is due this week. I have payroll this week. And all my leases on my equipment are also due.
So we need to keep food on the table. We need to keep the lights on and the heat in the house. We need to pay for healthcare because healthcare has never been more important.
Now, some important things to remember. Make the minimum payments on your credit cards. Ask creditors for leniency and focus on paying the bills you need to first. And remember, renters, many cities and states are prohibiting evictions, and homeowners with federally backed loans, you are protected from foreclosures for now. And tomorrow we will get the latest unemployment numbers for Ohio, and they're expected to shatter all-time records of 200,000 claims. Ohioans have expressed concern when it comes to filing online and calling that 800 number. And Lieutenant Governor John Hughes says the state now has 100 employees at that call center, and 180 new people are being trained right now, Jay.
Monica, she has quickly become one of the most recognizable faces and certainly one of the most important voices in the information and fight against the coronavirus. I'm talking, of course, about Dr. Amy Acton. She is the director of the Ohio Department of Health. She's getting national praise for the way she has handled the crisis here in Ohio, keeping all of us calm and steady with her approach. Our Russ Mitchell talked with Dr. Amy Acton yesterday, one-on-one.
You are in the middle of this. How are you?
I'm actually doing really well. I think I have to thank everyone out there. I feel buoyed by all the people out there who've reached out. I have an amazing team. I am not alone. You see me, but as I've said before, I'm the tip of the iceberg. So we have amazing people.
Let me get the latest from you, if I can, Dr. Acton. At this point, when do you expect the number of cases in Ohio to peak?
The dates are, it's ramping up daily. We're on that upslope. The peak is anywhere from end April. Perhaps, one number that's starting to salt out was around May 5th.
I've heard you speak several times about the Spanish flu of 1918, which subsided somewhere in the summer of that year but came back in the fall. How concerned should we be that that could happen this time around as well?
Some of what they're seeing in the data is that it will have surges. It will come back. It's until we have a vaccine, until we have immunity in our population, it's going to be a threat for us. And this is really going to be something we're dealing with over a couple years.
Let me just make sure I understand something you just said. We could be dealing with this for 2 years?
This virus isn't going to go away. It's going to spread. You can see in countries in Asia now, they're worried about it being reintroduced. Until we have a vaccine and actual population level immunity, those of us who haven't become sick in this first peak are still vulnerable.
What is this like for you? You have become a celebrity all over the internet, snacking with Acton. People can't wait till 2 o'clock every day to watch you and the governor. Personally, what is this like?
I know on some of those fan pages, and I'm so busy I can't be on them. My husband plucks things for me and shares, and I'm astonished and grateful. But it's not me, it's you. So keep putting on those pages stories of the people around you and the things you're doing so that you can all learn from each other and we can spread good ideas.
You've been incredibly optimistic throughout the course of this, but let me ask you, as a scientist, as a doctor, what hope can you offer the people of Ohio that things will get better?
I feel hope even now in the thick of the storm because I am seeing things that we have long forgotten and ways of us treating each other in our busy lives that we have forgotten. But I have absolute hope that we will emerge from this stronger and better than we've ever been.
Dr. Amy Acton, Director of the Ohio Department of Health. All the best to you.
Thank you.
And thank you so much for joining us.
Thank you.
All right, Russ, terrific job with the interview. You can see more of the interview with Russ and Dr. Acton. That's coming up tonight on What Matters Most at 6 o'clock. And Monica, she really has become the voice of calm, the voice of reason. She's done a terrific job in guiding Governor DeWine through this. Governor DeWine was on the forefront of a lot of the closures nationally and is now getting quite a bit of attention for that.
You're exactly right, Jay. Yeah, Governor Mike DeWine is now getting some international attention for his response to the coronavirus. The BBC is now praising his efforts here in Ohio to combat the spread and flatten the curve. And last night, the BBC posted this article spotlighting DeWine, saying he's made a difference by taking action early. And much of that, Jay, you can thank Dr. Acton for putting him in that position because, when he picked somebody to head the Ohio Department of Health, he picked somebody who truly knew public health and knew what she was doing. And certainly he is following her guidance as well. But he also has 30 years of experience to lean back on as well.
Absolutely. We're only as good as the information that we get. And I think it's very safe to say the information that Ohioans have been getting throughout this pandemic has been forefront and some of the best in the country. Well, when we come back, we answer more of your coronavirus questions. Our 3 News Connect Health Hub is just around the corner. Stay with us.
A lot of people need to replace their windows.
Joining me in the Health Hub is Assistant Medical Director for University Hospital's Emergency Department, Dr. Robert Hughes. What are the symptoms you want people to watch for, and are you assuming everyone who comes into the emergency department is infectious?
I think we're getting to the point where that's going to become a reality. Right now, we understand a little bit better the constellation of symptoms that come with coronavirus. Although, as data starts coming out of different areas of the world, we're starting to roll that into the way that we identify this disease. It was thought earlier on that somebody who was having diarrhea, per se, wasn't necessarily at high risk, but that seems to be a more pervasive symptom. So, as we learn more information about the disease, we are starting to identify more and more the people that are going to present with it. It presents very much like any sort of viral illness, including the flu, which comes with a non-productive cough, shortness of breath, but it tends to lack some of the other symptoms like nasal congestion. We're seeing a lot of similarities with the dry cough and the shortness of breath, particularly as the disease starts to get a little bit more intense. And then we're finding out that some other symptoms like lack of taste and lack of scent are also things that we ought to be looking out for. So the more data we can gather on what this presents with, the better we're going to be able to identify and address it. That people of certain age, over 60, people with medical comorbidities, particularly high blood pressure, diabetes, cancer, they're a special population that should look out for potential advancement of symptoms. This disease, from what we know, tends to have a slow build, and around day 7 or 8 of symptoms can become a little bit worse. And so people should start paying attention to the amount of time that they've had their symptoms. And if they have increasing shortness of breath, they can't catch their breath, they have dry cough, these are worrisome symptoms and reasons to contact their doctor.
Committed to bringing you facts, not fear. Monica Robbins, 3 News.
Thank you, Monica. And if you have any questions about the coronavirus, we're doing our best to get them straight to our experts. Text them to us, 216-344-3300. Again, that's a text message, not a call, 216-344-3300. Well, Giant Eagle is taking to new measures to help with the spike in curbside service and delivery orders, and there has been a real spike. The grocery chain is turning the store on Howe Avenue in Cuyahoga Falls into a fulfillment center only. The store will close to shoppers on Saturday night. When it reopens Sunday, it will be a pickup center only. You can order and pay online for groceries or on Giant Eagle's website and app. Some other stores also making huge changes in the midst of the virus. Costco says starting this Friday, only 2 people will be allowed in the store per membership card. Many locations are also shortening their hours to allow more time to clean and stock the shelves. And due to the demand, Costco is also adding another hour reserved for seniors and those with physical impairments to do their shopping. That will be available, this is important, every Tuesday, Wednesday, and Thursday, again, for seniors and those with impairments from 8 to 9 a.m. We also learned this morning that Home Depot will now allow a limited number of people into their stores at one time. We want to keep you up to date with all the latest facts on the coronavirus and its impact. To get a direct link to our coverage on your phone, just text the word FACTS to 216-344-3300. When we get information, you will get a text on your phone. 3 News Connect, coming right back.
To 3 News Connect. Parents, if you have little ones at home and you're struggling to entertain them, Mattel has a solution. The company launched a new digital resource called Mattel Playroom. It has activities and content from the company's biggest brands like American Girl, Barbie, Hot Wheels, and Thomas & Friends. And you can also join the social conversation by using the hashtag #KeepPlaying. Well, we know how the new election date is April 28th, and because of coronavirus, it is strictly a vote-by-mail election. So how's it going to work? Well, here's what you need to know. You need to request a ballot. You can either call your local Board of Elections, fill one out online, or actually go to the Board of Elections, where stations to fill out an application are set up outside. But election officials are stressing you should not wait.
The sooner we get it, the application, the sooner we can get a ballot, and then we're able to spread out the work over the next 4 weeks, as opposed to everything coming in right at the end, which can be just a little bit challenging based on volume.
So your last day to get your ballot in the mail is April 27th, but what if you moved? Well, there are measures for that too.
So they just need to go ahead and send in their application. And we will see that there's an address change, and we will send out a provisional ballot by mail for them to vote, which then also will serve the purpose of updating their address in our voter registration database for future elections.
Now, when you vote, make sure you elect the option for primary on your ballot. And just for clarification, this does not mean the voter registration has opened back up. You must already be registered to request and cast your ballot. Jay?
Monica, we want to update our viewers now on a story we've been following for some time now. I'm sure you'll remember 17-year-old Emma Fouts. She's the young lady that collapsed at her homecoming dance last fall. The Norton teen has come out of her medically induced coma. This happened some time ago. Now she is continuing her rehab at the facility, but Emma's family wants her home, as of course they're worried about her health here at the height of this pandemic. In today's 3 Heroes, Lindsey Buckingham focuses on dozens of volunteers that are working very hard to try to bring Emma home.
They say home is where the heart is. And for 17-year-old Emma Fouts, home is this hospital since last October.
Yeah, she's still at the hospital. She's still progressing really well in therapy.
Yeah! And making, in her mom's words, amazing strides in her recovery.
Her speech is coming along. She's really doing well with it. She's, more understandable as every day. She's just getting more and more of the enunciations and stuff.
In this home, Emma celebrated birthdays, spa days, surrounded with signs of support. Now, as coronavirus cases rise across the country, her family torn on where Emma should be.
I mean, it's devastating to know, we've been so far, and then to have something like this. When we were getting ready to bring her home, and now it's kind of, you struggle a lot saying, do we bring her home and worry that, if she comes home and she gets this virus and she has to go back in the hospital, is there going to be a hospital bed available for her? We just learned recently is this coronavirus causes ARDS, acute respiratory distress syndrome. That's what Emma had day 7. So we know that she barely made it through that.
But working behind the scenes, an army of selfless volunteers getting Emma's family home ready for her return.
We live in a split level home, so we're not able to, use a chairlift or anything like that. So we had to build an addition on the back side of our house. The addition is Emma's room, and it has a ramp that goes up to a chairlift, and then that will lift up to a deck, which leads into the door of her room, and it's a wheelchair accessible bathroom and bedroom.
Builders donating their time and supplies for free, working after their shifts, trudging through mud and water left from heavy rains.
Everybody's suffering right now. Everybody has their struggles and whatnot. For people to step up and come help us, we are so grateful and so appreciative of that. It is amazing how much these people have helped us out and continue to still come even in, these types of times.
These times, uncertain. We're all wondering where we'll be in the next few months. No one feels this more than Emma's family.
It's a big decision, and as a parent, you want to make sure that you make the right decision, and you want to make sure that it's the decision that's going to be best for her, because I don't want to regret anything.
Yet, no matter where Emma's home is, her heart is everywhere. In the hospital, the community, in the volunteers who are showing up every day to bring her back where she belongs.
And they're literally living angels amongst us, because they are amazing that they still come back here. They still help us out. We are so blessed. We are so grateful. There's not enough words to thank everybody for everything that they've done.
Hi, Emma, we love you.
Lindsay Buckingham, 3 News.
Wow, Lindsay, thank you so much for the update on a story that really has touched the hearts of all of us here in Northeast Ohio. Emma's mom tells Lindsay that a decision will be made in the coming weeks as to when Emma will come home. She'll continue to talk this over, of course, with her doctors. And Emma's mom also wants to stress this point. She thinks it's very necessary that we recognize all of those that have helped in this fight, and we couldn't agree more. And on that vein, we have put all of the names of those that have volunteered on our webpage. You can look for it at 3 Heroes on WKYC.com. And these are the stories we want to hear more of. Good stories of neighbors helping neighbors. We want to see your heroes. Send us a photo, a brief description. Text the photo to us at 216-344-3300. You can also share them with us on all of our social media pages. We really want to share these stories with our viewers. Again, text them a photo and a story, 216-344-3300. 3 News Connect is coming right back. Welcome back to 3 News Connect. Here are the 3 local coronavirus headlines that have you talking. First, the Cleveland APL, and this is sad. They've suspended adoptions until further notice. They really had no other choice, of course, due to concerns about COVID-19. Sheetz is launching a free meal program for kids in Ohio during this outbreak. That is a terrific piece of news. And a Cleveland woman shares her story of hope after recovering from coronavirus. You can find all of these headlines and more at WKYC.com and, of course, on our app.
It was a light show of a different sort of support for the staff of UH Parma Medical Center. They were showing the appreciation for the organizers who use their hazard lights as a way to show the appreciation for the medical workers on the front line and for those working in cleaning, food, maintenance, security, all of those who are on those front lines. And one woman told us she spoke to the nursing supervisor inside who helped get the nurses to the windows.
She said they are crying their eyes out. They're so appreciative of this support. So God bless our healthcare professionals for they took an oath and they're showing up at work. So thank you to all of them.
That's awesome. We want to know about your feel-good stories. Please send us a photo and a brief description. Just text it to 216-344-3300, and we just might share your story on the air. Love seeing and hearing about those stories, Jay. Thank you so much for joining us, everyone. We'll be back tomorrow with more 3 News Connect.
And, of course, we'll be along at 5 o'clock. Betsy Kling, myself, the entire 3 News team. With What's New, we'll have the story of Stipe Miocic. You talk about taking an oath. He's a UFC heavyweight champion of the world, Monica, yet he still feels compelled to serve in his main role. He's a first responder, firefighter, and paramedic in Valley View. I spoke with him yesterday. We'll have that story coming up at 5. Stay safe. Take care of one another. We'll see you soon.
This is Internet Stuff.